All right, so I'll go ahead and get started, and I would like to welcome everybody for joining us to today's Children's Budget Summit 2025. My name is Bruce Leslie. I'm the president of First Focus on Children, and we are celebrating our 20th anniversary this year. It's been quite a year, as everybody knows. And First Focus on Children. We're in the business of working toward making children a greater priority in federal budget and policy decisions, which includes trying to raise attention and visibility to the needs, concerns, and priorities of children and families during political and policy debates in this country. We'd like to thank you all for joining us today as we release our publication, Children's Budget 2025, which is our analysis of how children are faring in the federal budget. We have been doing this analysis since 2008, and over the years, we have often painted a picture of troubling trends. But 2025 is a very special year, and not in a good way. Between the DOGE, hostility from the administration for children's programs, cuts in agency staffing at the Department of Health and Human Services, the Department of Education at USAID, the so-called One Big Beautiful Bill, which had enormous cuts to programs like Medicaid and SNAP, and now the government shutdown. I will give you a spoiler, but I don't think anyone's surprised by this, which is that kids are not faring well. But I'll leave the details of this to the special guest we are fortunate to have today at our summit. Before we begin, I would like to give special thanks to our philanthropic and individual donors who make all of this possible. Thank you all very much. I would also like to thank the entire staff at First Focus on Children for all their work on the Children's Budget publication. You can find it live on our website at firstfocus.org. But we are also happy to send you all hard copies of it if you just contacted us. So we definitely want to distribute that and get it out to people. I would also like to thank Leo Gwynn at the Coalition for Human Needs for his assistance today in helping us host today's webinar. So let's get started, and I'm very pleased to kick off today's summit. And really, I have enormous pleasure of introducing Congressman Joaquin Castro from San Antonio, Texas. I've been a long, big fan of his. I'm from El Paso, Texas, so I've followed his awesome career through the Texas State House, but then when he came here to Congress. I have something in common with him, which is we both grew up in incredible households with amazing mothers, and who actually knew each other. I don't think, Congressman, you know that, but
Oh,
my
wow.
mom and they knew each other in Texas politics, as they were on the vanguard of raising important issues for both women and kids in the state of Texas. But when it comes to the congressman's work, I want to say that. Just very simply, Congressman Castro gets it. He just gets it fundamentally. He has, in his first days in Congress, when he came to Congress, I believe in 2013, right? I think.
Yeah, that's right.
Well, he has been a frequent flyer and honoree in our Champions and Defenders lists and awardees of people who do outstanding work in Congress on behalf of children. The congressman is a father of three. And he has been a steadfast champion for the world's most vulnerable children. He's one of the founding members of the Dad's Caucus and the founder of the Pre-K and Child Care Caucus. And as a member of the House Committee on Foreign Affairs, the congressman has been a leader in helping ensure that the United States became a global leader in protecting and nurturing the youngest and most vulnerable children across the world. He has been a lead sponsor of the Global Child Thrive Act, which was passed in 2021. And it advanced a bold vision that every child, no matter where they are born, deserves the opportunity to reach their full potential. Congressman, we are so appreciative of your outstanding leadership on children's issues throughout your entire time in Congress, but also that you have both the perspective of working to protect kids here and abroad. And we really want to thank you for joining us today. So I turn it over to you. Thank you.
No, well, thank you so much, Bruce. Thank you for the introduction. Thank you for all of your hard work over so many years, and also to all of the staff, to the sponsors, to everybody at First Focus on Children for once again producing this very important children's budget. Every year, your work reminds Congress that a budget isn't just a ledger. It's not just dollars and cents on paper. It's a document that reflects our priorities as a country, and it tells us in hard numbers what and who our nation values. And this year's children's budget, 2025, makes that message, unfortunately, painfully clear. For the fourth year in a row, children's share of federal spending has fallen down to just 8.6%, the lowest level in decades, with further cuts proposed in the president's fiscal year 2026 budget proposal. And behind those numbers, of course, are real children's lives, children losing healthcare coverage, access to food, and early learning opportunities. The children's budget notes that H.R. 1, which I'm going to call the Big Ugly Bill, that passed earlier this year, would cut an estimated $182 billion from Medicaid and $80 billion from SNAP over the next decade. Those two programs alone serve nearly 16 million children across our country. That's why I want to thank First Focus for shining a bright light on these issues for legislators in Congress and for all Americans. You give policymakers the data and the moral clarity we need to push for change. And I'll be taking these recommendations to heart, as I know many of my colleagues will. And Bruce mentioned that I'm a dad. My wife Anna and I have 3 kids, an 11-year-old, a 9-year-old, and a 3-year-old. And as the co-founder of the Dads Caucus and the Pre-K Caucus, I know how much it matters when we invest early in children. When we make sure that every child has a safe home, a strong school, and a fair chance. That same belief drove me to author the Global Child Thrive Act, which I worked with my colleagues to enact into law in 2020. The Global Child Thrive Act integrates early childhood development into U.S. foreign assistance programs, supporting nutrition, health, and education for the world's most vulnerable kids. Passing the bill was just the first step, though. I have worked over the last 5 years to build a coalition to ensure the law's implementation and increase appropriations for these programs. As many of you know, and as the children's budget so clearly lays out, the Trump administration eviscerated U.S. foreign assistance programs and, quite honestly, devastated children around the world. The report outlines that a recent study by The Lancet estimated that an additional 4.5 million children may die in the next 5 years as a result of the administration's cuts and closure of USAID. And this is an unimaginable tragedy. As a senior member of the House Foreign Affairs Committee, I've worked to get supporting vulnerable children back on the agenda when it comes to foreign assistance. And first, I've been pushing the administration to reappoint a special advisor for vulnerable children, a position established in law and tasked with coordinating U.S. foreign assistance programs that support children around the world. While this has traditionally been a USAID position, the law provides the Secretary of State the authority and actually the requirement to appoint someone to that position. So I've urged the administration to appoint that individual as soon as possible. I've also authored legislation to reauthorize the Global Child Thrive Act and require the administration to produce a new strategy to implement the bill, as the existing strategy from the 2020 legislation relied heavily on USAID for implementation. So I'm happy to say that I secured bipartisan support for these efforts and successfully included them in a recent committee markup of the Foreign Affairs Committee. While nothing can truly reverse the sheer devastation of the administration's cuts to foreign assistance programs, I'm hopeful that as we build back, vulnerable children are not left behind. Because whether it's in San Antonio or South Sudan or anywhere in the country or the world, investing in children is both the right thing to do and the wise thing to do. It strengthens families, communities, and democracies alike. So thank you again to First Focus on Children for holding all of us accountable and shining a light on the decisions that we make that impact children's lives. Together, let's make sure next year's children's budget tells a different story than the last 4 years, one of renewed commitment and hope for every child. Thank you all so much for all of your amazing, important, and incredible work. Thank you, Bruce.
Thank you, Congressman. We really appreciate it. Thank you for joining us and all that you do. All right. Thanks again to the Congressman. And now I'd like to introduce my awesome colleague, Chris Becker. Chris is the Vice President for Budget Policy and Data Analytics at First Focus on Children. And before joining us, Chris was the Senior Economist and Associate Director of Policy and Research at Groundwork Collaborative. He is an incredible guy who he has his PhD in economics from Stanford. He also has a BA in economics and a BS in mathematics from Marquette University. And is originally from the Chicago area, but he probably will get mad at me for saying this, but I also want to highlight that he recently got married, and we've been happy to enjoy his pictures and all that he has done personally as well. But Chris, I want to turn it over to you. He's the brains behind the book today. So thanks so much.
Thank you, Bruce. So I'm just going to go over some of the main findings from the Children's Budget 2025. Next slide, please. So for anyone who doesn't know what the Children's Budget is, it's something that we put out every year. And we track over 250 programs that in some way invest in the needs of children across the entire federal government. Some of those are things like early education programs that exclusively spend money on children. Others are things like Medicaid and SNAP, which serve lots of populations, but in those cases, we estimate the share of spending that's going to kids from those programs. And our end goal is to try to understand the extent to which the federal government is prioritizing children. And the central statistic we have to capture that is that we track the share of federal spending going to children each year. In addition to that, we try to look at trends over time. Is that investment in children going in the right direction or the wrong direction? Unfortunately, recently it's been mostly the wrong direction. And then we also do deep dives by our policy experts on staff into various issue areas, things like health, nutrition, education. And the idea there is that we want to know for all these different multiple needs that children have, are we investing in those areas? Ideally, we would want to see the share of spending on children going up, but also each of these issue areas trending in the right direction too, so that we're meeting all the different needs of children. Next slide, please. So to cut to the chase, what we find is that for the fourth straight year, in fiscal year 2025, the share of spending on children has gone down. We've gone down to just 8.57%, which means that for every $100 that the federal government spends, only $8.57 of that goes to children. So not really a big portion of the federal government's money is being spent on children. And this is especially disappointing because we've shown conclusively that we can do better. In fiscal year 2021, the share of federal spending on children was all the way up at 12%. Still probably not enough, but much better. So we've declined in the share of federal spending on children over 25% in just those last 5 years. And that makes a lot of sense because in 2021, we were doing a lot of things that were really good for kids. We had economic impact payments that were giving cash directly to families that had kids. We had an expanded child tax credit that offered the full child tax credit to poor families with low income. We had increased spending on SNAP, increased support for local school districts, all these different programs that disproportionately helped kids. And since then, we've phased out all of that really good stuff that was very successful, including reducing child poverty by half. So we're moving in the wrong direction. And the last thing I would emphasize here is that the proposed president's budget would continue that negative trend. The proposed president's budget, if it were passed, would reduce the children's share of spending down to 8.28%. Next slide, please. So the other thing we like to look at is whether the spending on children is keeping up with inflation. That's especially important in a year like this one, where fiscal year 2025 was a continuing resolution where most of these programs that affect kids were flat funded. And what we like to say at First Focus on children is that flat funding is actually a cut, because you're keeping the amount that you're giving parents to meet their children's needs the same, but at the same time that's going on, the prices that they're paying are going up. So you give them the same amount to support their nutrition, but the price of food is going up. And so the purchasing power of these investments in kids goes down as the prices go up over time. And so what we find is that over that window, fiscal year 2021 to 2025, the investment in children has lost about 40% of its purchasing power. So we're about 40% behind those increases in inflation. And that's again 4 years in a row that children's spending has declined, adjusted for inflation. Next slide, please. And then the other thing we look at is how specifically are we investing in the needs of children internationally? And here the story is actually much sadder. We find that in fiscal year 2025, only 0.09% of all of the federal budget goes to children around the world. And so that tells you two things, I think. One is that we often see foreign aid spending scapegoated as this thing that America can't afford, that's some big driver of the deficit, things like that. Clearly, that's not the case. This is a very small amount of money in the grand scheme of what the government is spending. That being said, this is a very, very important pot of money. This is reducing malaria. It's treating tuberculosis. It's meeting the needs of children facing natural disasters, humanitarian crises. This is life-saving money, as the congressman highlighted. And we, unfortunately, are not doing nearly enough to meet the needs of children internationally. The other thing to point out here is that not a lot of foreign aid spending that does exist really does go to children, only about 10.8% in fiscal year 2025. So we don't prioritize children even within that small bucket of foreign aid spending. Next slide, please. Again, this would get much worse if the proposed budget under the Trump administration, the Trump administration's proposed budget for fiscal year 2026 were passed. That would take the share of children's spending internationally down to 0.03%. So for every $100 we spend in the government, the federal government, it would only be 3 cents of that $100 going to kids internationally. You can see that visually here in this pie chart. That big blue portion is everything else that we spend, and that tiny little sliver is all that goes into those life-saving investments in children abroad. It's not enough, and it simply, we can't allow this to happen morally. Next slide, please. So then, how are we doing by these different issue areas that we track? Most of the trends over the last 5 years have been not so great in each of our issue areas. So for early childhood, education, income support, justice and child protection, nutrition and training, all of those have declined, adjusted for inflation since 2021. The only two bright spots are health and housing. Housing, I think, is the pretty legitimate bright spot there, given that there is such a housing affordability crisis. Health is another bright spot. A lot of that is being driven by increases in Medicare, or Medicaid, I should say, Medicaid over time. But we will get to in a second why there might be some concern about that going forward. Next slide, please. So focusing in a little bit more on the president's budget, this year for fiscal year 2026, the president's budget was really focused on discretionary spending. It doesn't really do much with the mandatory spending. And so this is kind of really where you want to focus. You want to see what direction the Trump administration is trying to take us. And the news for discretionary spending for children in the proposed budget is not good. The proposed budget would cut discretionary spending for kids by about 23.66% adjusted for inflation. So just in 1 year, a quarter decline almost in discretionary spending on children. And it would reduce the share of children's discretionary spending on children to 5.81%. So even smaller share of discretionary spending than for the spending as a whole, which was more like 8.5%. And again, that's really down since fiscal year 2021. That would be almost 60% less than the share of discretionary spending that we spent in fiscal year 2021. So a huge decline in discretionary spending over this time, and an even bigger one if the president's budget were passed. Next slide, please. And what a lot of that drop in discretionary spending is driven by is that the president's budget proposes either eliminating or consolidating over a third of the programs, a third of the discretionary programs that we track in the budget. And so 22% or so of the discretionary programs that we track in our book would be completely eliminated, and another 15% almost would be consolidated. So that's things like IDEA spending, which is spending on special education within the Department of Education, will be rolled up into a more general consolidated fund where those special education programs, there would be no guarantee that those things would be funded by the states. And there's a lot of examples like that where the money may be maintained or may be cut, but there's no guarantee that those specific funding streams would be maintained. And so altogether, it's over a third of those programs. So that's a big drop in money, but also just a lot of these important specialized programs that meet the needs of children would be eliminated. So it's both the scale and the breadth of reductions in the budget. Next slide. Oh, okay. I did my other slide there got lost, but the last thing I wanted to talk about was that all of the numbers that I just said do not really tell the full story. In fact, the worst of it, in a lot of ways, is what has already been done in reconciliation. So we had HR 1, which was the reconciliation package that was passed earlier this year. And we know that that would be a huge cut to Medicaid and SNAP, specifically about $182 billion to Medicaid and $80 billion in SNAP. So none of those numbers show up in the children's budget because those are cuts that are going to happen down the line. We're not going to see those show up in our budget numbers for a couple of years, but we know that these are huge cuts to these programs that are essential for the medical and nutrition needs of children. And so as bad as these numbers are, we actually have a lot of reason to believe that it's going to be worse going forward. That's in addition to things like all of the chaos at USAID and rescissions packages that have clawed back some of the funding that's already there. So yeah, this is basically just saying what I was just mentioning. But yeah, in a lot of ways, the worst is yet to come, unfortunately. And with that, I will wrap up and thank you all for listening to me and being here for our presentation of these not so fun findings.
Thanks so much, Chris. One thing I just want to point out for people is if you see a discrepancy in the number that you know is the overall cut level in Medicaid and SNAP, what Chris and the Congressman were highlighting was the children's share. All right, Chris. So I'm looking at some of the questions in the chat, and I'll try to capture them. So from Ruth White, who is a friend of ours. She talks about sort of like the decline since 2021 in the share of spending for kids and knows that some of that was COVID relief. And you talked a little bit about that, but can you sort of talk about kind of the enormity of the decline, but also that even though everything dropped, what our book really shows is that kids disproportionately were cut. So can you speak to that?
Yeah, I mean, I think it is a lot of these COVID era programs that were really good. And so there are some of those that were really broad based, like the economic impact payments, the cash checks that people were sent, and those help everybody. So those are great for children and great for everyone else. Unfortunately, there are other things. Well, fortunately then, unfortunately now, things like the child tax credit, which is exclusively for families with children. And what we did there was we expanded refundability of the program so that even if you were a low income family who didn't have a lot of earned income, you could earn the full child tax credit. And so that was, billions of dollars going to low income families with children. There were things like the Education Stabilization Fund that gave money to school districts that were struggling. There was the Child Care Stabilization Fund, which was very specifically focused on childcare. So again, these are good for the country as a whole. All of these are great for all Americans, but those are programs that are specifically targeted at children and disproportionately helped the youngest people in our society. So when we got rid of those, it not only decreased the total that's available to children, it really disproportionately impacted children relative to other people.
That's excellent. And I'll try to combine three questions here that I see. One is people ask sort of the question about, and you said some of this is that the numbers are actually going to be worse. That our analysis doesn't capture everything. And so, for example, Mitch Lifson asked, does this include the approved appropriations that the administration canceled or withheld? Right. So some of the cuts that they made unilaterally. And then Mark Ingman asked, beyond the terrible budget news, what are some of the policy decisions the administration has made that hurt children or parents who try to take care of kids? And then last, another question was about the government shutdown and how can advocates and congressional staff use the children's budget as a tool. So sorry to throw three questions together, but I think you'll handle it well.
Yeah. Well, the shutdown, is currently a big threat to children, of course. I know that the running out of funding for SNAP is probably the thing that stands out as the most obvious. The support for the nutrition needs of children. We will soon be in a place where that money is not going to be available to kids. So that's an obvious one. But across the board, the government is not going to be able to provide the services to children as effectively if we don't have people staffing these government jobs that are meeting the needs of children. It's just going to be a much less effective service, even where the money isn't necessarily running out. In terms of what was the second question?
It was about kind of what are some of the other areas that are,
Yeah.
that are being cut or impacted that
Right.
even if they don't
There, so we have not included things like rescissions where the administration is clawing back some of the funding that has been appropriated. We do talk about that in the narratives sections of the book, so you could definitely find some details there. But there's a lot of money that's been clawed back, and that's obviously going to mean less money going out to kids than what we show in the book. In the international space, it's hard not to see disruptions everywhere. I mean, even money that was funded, we know that the Trump administration unilaterally canceled, withheld funds earlier in the year, is trying to get rid of USAID. All of these disruptions have already led to the loss of probably hundreds of thousands of lives of children. But as the congressman emphasized, could be millions and millions of lives going forward as the negative effects of those disruptions accumulate. So it's really, I think, the children that are being harmed the most by all of these disruptions is probably the kids internationally, where I can't emphasize enough, this is life and death. It's whether you get malaria, it's do you get tuberculosis, it's is there support for you when there's a natural disaster. It's all these things that it's life and death for children, and these disruptions have been devastating already and will get worse.
Yeah, and then let's see, I'll do kind of one final question, but before I do, I'll sort of answer one of them myself, which is some of the questions have been sort of like the magnitude and what can we do about it, and certainly Chris, I would love your thoughts on this too. But I just want to highlight for folks that we run, Michelle Dalfor in our office runs the Children's Budget Coalition. And so what you can do about it, we would love for people to join the Children's Budget Coalition, but also to follow our work, at firstfocus.org, or we now are kind of creating a Substack account, and we'd love for people to subscribe there because we're going to be trying to get more and more information out, not just to our partners here in DC, but really to the public. I think the polling really shows, and the sentiment of people is that they support investing in kids overwhelmingly. We did a poll a few years ago, and by more than a 5-to-1 margin on every single policy issue, people think we should be investing more in children, not less. And what Chris is showing is we are doing the exact opposite. And not only are there these cuts, but they are disproportionate. I think that's really important to emphasize. So the DOJ may have come in and made cuts, but what we're finding is that they are disproportionate to kids. They're not uniform. And so this is a huge challenge for us. But we would love anybody and everybody to join us in our efforts to sort of turn this back. And then let's see. Anne Mary Coburn asked whether we're participating in the litigation. We have signed support letters and things like that. We have not filed amicus on those issues, but we are signing a lot of letters and things to the Hill and to the administration about that. And we would note another question in the chat was about Healthy Start and the cuts to staffing. And we would note that in the shutdown, they actually eliminated the office in terms of the staffing. This is a program that was created by George Bush to fight infant and maternal mortality, and now there's no staff in the office. So, Chris, any added thoughts on sort of those points on staffing?
Yeah. The last thing I'd emphasize is that I didn't emphasize this in the presentation, but the cuts, even the huge cuts to USAID that are in foreign aid that are proposed in the president's budget are also disproportionate to kids as well. So even though they are cutting foreign aid across the board, we show that the share of spending on children internationally also declines. So it's also true internationally that a lot of these things are disproportionately harming kids, and which also makes sense because there are a greater proportion of children internationally than there are in the United States. So a lot of foreign aid spending is, disproportionately for kids because a lot of foreign aid spending is going to places where there are a lot of children. So that's another point I'd make.
Yeah. So thank you so much, Chris. Thank you for all your hard work on this. And again, I just want to point people to you can get a copy of the report on our website, firstfocus.org. And again, if you would like a hard copy, please contact us and we'll be happy to send you one. So thanks, Chris. And with that, I'm going to move on to our next two amazing presenters today, and we really appreciate them. They're joining us. Our first presenter will be Chantel Meek. Chantel is a dear friend, and she's the executive director of Children's Equity Project and a professor of practice at Arizona State University, where, just as an aside, I got my master's degree. So I am a ASU fan, but a bigger fan of Chantel's work. At the Children's Equity Project, she works with partners at 18 universities and nonprofit organizations, as well as policymakers and national organizations, to put out really fantastic reports and analysis of the importance of public programs for kids and how to improve them and ways that they serve children and families. Prior to the position she has now, she served in the Obama administration as a senior policy advisor for early childhood development at HHS and as a senior policy advisor for education at the DPC, or Domestic Policy Council, at the White House. So she'll be our first speaker. And then also I'll go ahead and introduce another really terrific friend, Luke Schaefer. He is a professor at the University of Michigan and one of the nation's leading scholars on poverty and social welfare policy. We hosted him. If you want to hear more from him after today, go back to our podcast, Speaking of Kids. We hosted him and he was fantastic, talking about some of his work in these areas as well. He's the director of Poverty Solutions, an initiative that partners with communities and policymakers to find new ways to prevent and alleviate poverty. And he's a co-director of RX Kids, the nation's first citywide maternal and infant health cash prescription program, launched in Flint, Michigan in January 2024. His published works include numerous reports and books, including The Injustice of Place, Uncovering the Legacy of Poverty in America, which links economic data, health outcomes, and local history and traditions. So so again, thank you both for joining us. And Chantel, I'll turn it to you first.
Yeah, I'll jump in. So I have a few slides, and thank you, Bruce. I'm just as big a fan of you and your work and the organization. So I'll jump right in. I'm going to focus domestically and I'm going to focus on the earliest years of life and just talk a bit about that. So we know that research tells us, gives us good news and gives us bad news, right? The good news is that we know that high quality early learning experiences are associated with a whole range of positive outcomes later in life and throughout the life course, right? We have outcomes in health and education, employment, earnings, so on and so forth. So we know what works. We know what matters to healthy and positive development, which is good news. The bad news is the state of the systems that serve kids and families in this country. We have differential access and different experiences in early childhood education in our country, which results in our big challenge, right? Which is that our systems have never been fully funded and offer differential access and uneven quality to kids across the country, which presents inequality and opportunity before kids even step into kindergarten. So if we go to the next slide, we show kind of how we stack up globally, right? The list of countries at the bottom is in descending order. So I think the big takeaway there is that we're near the very end of the line there, the back of the line in terms of access to pre-K or early education in the years before school starts. If we go to the next slide, just a focus on why the early years matter, right? And I think first and foremost, because children are full humans and deserve to be happy, healthy, cared for, loved, and have access to opportunity and all the early education experiences they need first. But there's been decades and decades of brain science now, education science, economics that have really amplified and showed us with data why those early years and why childhood is so important to set the foundation for the rest of the life course, right? We know that brains start being built prenatally before birth, but really ramp up over the first 1,000 days and really the first 5 years of life. We know that there is a sensitive period in early childhood where brains are the most open to change and influence. I'm sure anyone who's tried to learn a second language in adulthood compared to kids who pick it up right away kind of see that distinction or anything new. And that presents good news and bad news, right? The bad news is that negative experiences in early childhood do have the potential to set a negative trajectory and have longer term negative impacts. And again, on the flip side, positive experiences and ensuring kids have what they need to develop healthily sets up kids in a positive trajectory. There's also ROI studies that have been done, very, very famous ones, that have looked at outcomes into adulthood and looked at the return on investment of early childhood programs, and it really having one of the highest returns for society in general. If we go to the next slide, just a few examples of how this happens, right? We released a report recently looking at Head Start in particular, and the different impacts of Head Start, short-term, medium-term, long-term. So we dove into the literature on language and literacy and found a number of positive outcomes there. If we go to the next slide, just as examples, we looked at cognitive development, math, and science, and found important outcomes there. And so if we turn now to the next slide and thinking about, okay, who are we serving and what does that look like in terms of the federal budget? Head Start makes up a tiny little fraction of a percent of the budget, but it's serving a chunk of our kids who are living in poverty in the United States, about 30% of kids living in poverty in the United States, over 805,000 kids in nearly every zip code in the nation, right? And so again, this is telling us that 70% of those kids are not receiving services, but it does have this program a really big footprint across the nation. So if we go to the next slide. Yeah, so Head Start plays, again, an important role in the percentage of kids in poverty who are served by this program. And so in some places, we have upwards of 50% of kids in poverty who are served by this program. Next slide. Head Start also plays an important role, right, in jobs and in the early care and education workforce and in the adults who are doing the really hard and really important work of caring for our kids. So 250,000 jobs are supported by that tiny little fraction of the budget. We keep going. Here we kind of looked at the role that Head Start programs play in childcare and a particular emphasis in rural communities. So in a lot of rural communities in our analysis, we found that Head Start programs are often some of the only licensed center-based early childhood programs in communities. And so here are just some examples. In Graham County, Arizona, for example, about 84% of kids under 5 in poverty are served by Head Start. And Head Start slots make up over 90% of the total licensed childcare slots in the county. And so we know we have childcare gaps where parents need childcare, high quality childcare that supports child development while they work. And we know that there is not enough of it. And so Head Start makes up a part of that. So if we go to the next slide, a different report, we zoomed in a bit more in Arizona, and you'll see that Graham County is quite high at 90%, but you'll see the percentage of Head Start slots that make up childcare capacity is quite high in a lot of the more rural communities in the state, 73%, 90%, 60%, significant chunk, and that's not unique to Arizona. If we go to the next slide. We also see Head Start serves a chunk of kids with disabilities, and children with disabilities, preschoolers with disabilities receive their special education services within Head Start programs. And so in some places, such as Puerto Rico, West Virginia, Iowa, Montana, we have upwards of 20%, 30% in some places of kids with disabilities receiving their services in Head Start. Next slide. If we think of IDEA, the Individuals with Disabilities Education Act, so that's really the early intervention and special education systems in the country, again, makes up a fraction of a percent of the budget. And that's for all kids, for all of IDEA, not just young children. But the footprint that it has and the importance of IDEA in early intervention. So this chart here is showing over 500,000 preschoolers with disabilities are funded through IDEA to receive preschool special ed services. And in the next slide, we see early intervention numbers. So these are the babies, infants and toddlers with disabilities and delays served across the country, almost 500,000, a little bit under that. Go to the next slide. Childcare, this is the other big investment in early childhood within the federal budget. Again, you see the pattern, right? A fraction of the overall federal budget, and we see limited access, right? So under federal rules, we see 11.5 million kids who would be eligible to receive childcare support. But we only see 1.8 million receiving a subsidy under those 15% under federal rules, 22% under state rules. And that's from a GAO study that was published last year, really looking at childcare subsidy access. Next slide, please. And we're just rounded out with Title I, which is education funding for schools that serve a certain proportion of kids who receive free and reduced lunch, children living in poverty and in low-income communities. Here again, we have the pattern, right? A fraction of a percent of the budget, right? But it's really serving over 60% of schools are receiving funding. And if we look at the number of students, it's estimated about 26 million students and nearly 90% of all school districts in the country receiving Title I funds. Again, a drop in the bucket really when you look at the overall federal budget. Next slide. I think that's it. All right, I'll hand it back to Bruce now.
Excellent. So I'll turn it over to you, Luke. Go ahead.
Hey, it's great to be with you all, and I just want to thank Bruce and Chris and the whole team at First Focus on Children for the children's budget. I'm a big believer in the adages, show me the money, and put your money where your mouth is. And our investments and where we put our money talk a lot about not just the dollars and cents, but the values that we have as a nation. So you can see in all the slides from the children's budget, which I have to recommend everyone take a look at, digest, look what it means for the country. I want to talk a little bit about some of this huge decline in investment of children and what it means for well-being. We're talking about the money, but the money is really about talking about the well-being of the people that we're trying to serve. So when we look at the child poverty rate in the United States using the supplemental poverty rate, which is agreed by scholars, if we pull that up, we can see that we had quite a bit of stability for about 20 years prior to the expanded child tax credit and the measures that we put into place during COVID. And then a huge shock downward, so much so that in 2021, when you saw investments in children hit the all-time high, we were at 5.2% child poverty. We did that as a nation. We proved that an entirely different future was possible, that we could invest in kids and we could fundamentally change the outcomes. So child poverty hits an all-time low. Millions of children are lifted out of poverty. And then those things were allowed to expire. They were priorities of the president. But we missed it by about one vote, and those things were removed, were not extended, and we see child poverty pop back up as our investments in kids start to go down. But it's not just kiddos in poverty that are impacted. If we look at a broader set of outcomes, we can see that child poverty falls down to an all-time low. But on our next slide, we also see the number of kids and the proportion of kids who are below 200% of the poverty line pops down to the lowest level ever. So scholars think of this 200% as really sort of the line where you're reaching into the middle class. And so we had more families sort of pop over that line and maybe be more likely to deal with an unexpected expense, whatever it is, during 2021. And when those programs were allowed to expire and the investments went down, that popped back up. And that dashed line is actually an entirely independent measure. I always love it when two independent measures that are trying to get at a lot of the same thing tell a similar story. So this is the proportion of parents with kiddos who are saying they can't afford a $400 expense. You see it's tracking downward during the longest economic recovery that we had always had, that starts under Obama and goes through the first Trump term in 2019, and then in 2020 and 2021, with these historic investments, they hit the all-time low of people saying they cannot afford a $400 expense. We have another measure that asks families in the next slide, are you doing okay financially? And so if you track that lower one, we see that's improving during that long economic expansion. And then 2020 happens, and everyone who has kids knows that right at the beginning there was a huge amount of reason to be scary. In fact, as I think back to where I was in 2020, the beginning of COVID, I vastly underestimated the public health crisis, but I was absolutely panicked about the economic crisis. But the federal government, starting actually with a bipartisan set of policies and extending into the Biden's term with the expanded child tax credit, put a number of investments in place for families with kids. And we see this measure too pop to the highest level that it's ever been at, 75%. And those expire and immediately we lose those losses. So these are reasons for to be despondent. I think a lot of us are right now, but also reasons for hope, right? We now definitively can say when we invest in children in smart evidence-based ways, that things can get better. We can see child poverty absolutely plummet. We can see the number of families reaching into the middle class go to the highest level ever. We can see families saying that their financial well-being is the best. Food insecurity goes down. This resulted in measurable impacts for families out there. So I think we were at a fork in the road as a society, and we decided to basically take a U-turn to where we were before. Not just that, but to go even further. I was panicked about the budget deal this summer and what it meant for SNAP. There's a number of things to be concerned about if we just focus on that one program. To have work requirements on SNAP for the first time for families with older kids. It's just a question of where that starts and where it's going to end, right? And what it means for families with children. We know that SNAP can impact the health, right? Especially when it's received in early years, that can have lifetime impacts on the health and well-being of kiddos, on economic outcomes as well in adulthood. We know it impacts test scores. We know when the benefit cycle starts to run out, that disciplinary challenges increase at school. So there's so much reason to think that this program fundamentally matters to the well-being of families with children. And already, just during the summer, we were talking about not just work requirements for families with older kids, but also all of these changes in the financial arrangements with the federal government and states, which are really going to call into question the ability of states to administer this program. So it's a big and open question about how those are going to be implemented, if governors, I think, are going to be successful in pushing those back. But then it's like a cascading effect that I think a lot of us feel with the news that the Trump administration is deciding to suspend SNAP benefits during November. So this is a policy choice. There are ways that SNAP benefits could be extended for another month, at least partial benefits. In the first Trump administration, we had a longer shutdown than we are at right now. And this was never on the table. It was never being considered that we were going to suspend SNAP. So here we are at this moment. They're making a policy choice to pull $7.8 billion just in 1 month, $7.8 billion in food assistance to senior citizens. We're talking about 8.4 million senior citizens that depend on SNAP. And you might only have Social Security and they're depending on SNAP for their food budget. We're talking about 4 million people with disabilities and close to 17 million children. So those impacts that we see, even as the SNAP benefits over the course of the month start to dwindle, we're going to see those, I think, quite immediately, right? A reduction in test scores. We're going to see more disciplinary challenges. But SNAP benefits also fold into people's other budgets. So it's not just going to affect their food security. We're talking about their rent. If this goes on for any meaningful period of time, I think we can expect people to fall behind on their rent, fall behind on their mortgage. And then I think we have much bigger inflationary concerns with the overall picture. Not inflationary, I'm sorry, recessionary concerns with the overall picture of what it means to have grocery stores that depend on $7.8 billion in food assistance for families who need it to put food on the table, to have all of that pulled out, especially in rural communities. We know programs like SNAP and the expanded child tax credit have a disproportionately positive effect. Programs that are sort of more controlled by the federal government in terms of what is provided and how it's provided are essential to rural communities. And we're talking about pulling the rug out in a very short amount of time. So there's a lot of reason to be despondent and not know what to do. I do get the incredible joy of being a part of a program that does still provide a lot of hope for me. It's RxKids. It is a community-wide, the nation's first, as Bruce mentioned, the first community-wide prenatal and infant cash transfer program. It's a program that's now active in 11 different communities. It started in Flint, but we're now in 10 other Michigan communities, including covering 6 rural communities. The totality of those 6 rural communities, any woman who's pregnant receives $1,500 during pregnancy one time, and then $500 a month for their kiddo for 6 months to a year afterwards. And I've shared a couple of the recent studies that have just come out on this. And again, I think it shows what's possible when we invest in evidence-based way on kids, in exactly the type of thing that this children's budget report is trying to highlight. We can make a difference. We just published a paper on reduced postpartum depression, reduced evictions that families in Flint compared to families in the surrounding area who don't have access to the program have seen in the first year of program operations, and another one on prenatal care. So we see that is that a prenatal benefit that says nothing about you have to go to prenatal care. There's sort of nothing about like the conditions on it, but expectant moms are using it to go to prenatal care. They're entering into prenatal care earlier and they're going more often. And so I think that is shows out like the Milton Friedman libertarian argument that by providing a cash transfer, especially to a set of people who have the economic storm that is having a baby in this country, we can show different results. We can show different behavioral results. We can have a program that has low administrative costs, produce a lot of benefit, and translates into increased well-being of families and children. Thank you.
Awesome. Thank you both. And if people want to put any questions in the chat, we won't have a ton of time, but I do want to ask you both one first question, which is you both have made very compelling arguments in your presentations about why money matters, but there has been this sort of renewed questioning of, does money matter? Does making investments in kids have benefits? And again, you both wanted to, a number of examples, but definitely want to give you another shot at, like, how would you respond to critics who say, it's doesn't really have that big of an impact, when I think we would all agree that it has enormous impact. But how would you all respond to to those critiques or criticisms?
Yeah, the first part is to contextualize in a mountain of evidence. We have so many studies on SNAP, on cash transfers, on the EITC, but internationally, it turns out child allowances, child benefits, it's this act of saying, you know what, raising kids is expensive and society can help families with a little bit of money. Shows up in reduced poverty rates, improved investments in kids, reduced food insecurity. So we had two studies during COVID that called some of that into question. It actually, both studies found that providing cash leads to increased investment in kiddos. If you want parents to read to their children more, it turns out cash in the published papers about these very studies, that is the way to do it. It's more cost effective and more effective than most reading interventions. Of course, we want both, right? We want to be doing both, but this is an effective way to do it. But it didn't see some of the impacts on some of the other things. Unfortunately, for these studies, they were done during a period of unprecedented cash transfers, right? You think like the study period that we're really looking at with these is right in that first slide that I showed you, when we provided a lot of cash and we saw the lowest poverty rate we'd ever had. We saw the mental health of parents really positively impacted during that period. We saw lots of financial stability measures hit their all-time high. And so it's sad for those studies that was the period that they were collecting, because you can't really imagine a study period that would be more contaminated than one where everybody's getting the treatment in a way they've never gotten before. And there's a huge amount of evidence that that worked. And then on top of that, if we're measuring childhood development, we can see study after study that indicates everything went haywire during the COVID period. And so I think these are important studies. They're done by great people. They're my strong colleagues. I had concerns about some of the ways they were being fielded early on, but they're really good scholars. But we have to contextualize that in the mountain of evidence. I think if we didn't do any sort of intervention, any sort of program that had a study that found it didn't work, we wouldn't do anything at this point. It just turns out that you have to use a whole body of research in order to say something. And I think the whole body is quite clear on this question.
Yeah, I mean, I'd just add, I guess in the early childhood space, one of kind of these talking points is that it's about efficiencies and, running our systems better. It's not about more dollars, and that's just false. I mean, you could have the most efficient, perfectly run program, and there are not enough dollars to give all the kids who need access to high quality early education. Most of my slides just focused on access. It didn't even break into quality, which is a necessary, fundamental, number one thing we need in order to get the outcomes that we're looking for. So money matters a great deal. And we simply can't, the dollars that we have right now, they just don't work to ensure quality and to ensure access. I think on the K-12 side of the house, there are similar arguments, right? We don't need more money. We need, these reforms or those reforms. That's also not true. There's a lot of research that's been done. I think 2023, there was a National Academy of Science, Engineering, and Medicine report published that looked at the opportunity gap and looked at school funding as one of those pieces. And just a couple of studies that were highlighted there. One study found that for lower income children, a 20% increase in per pupil spending each year for the duration of their public school was associated with nearly a full additional year of completed education, 25% higher earnings, 20 percentage point reduction in the annual incidence of poverty in adulthood. Other studies found that even an increase of 1,000 per pupil expenditure per kid had positive impacts on kids, on their achievement, and on college going. So this argument that money doesn't matter, that it's all these other things we need to do on efficiency, just doesn't really hold water in the research.
Good. No, I appreciate that. And so one question in the chat is about for you, Luke, which is where did the money come from? The initiative, but then I'll also ask this question for both of you. And on this one, Chantel, you go first. Is kind of what can we do? Like what are things that would be helpful to sort of make the points that you all have made, and how to get this into the hands of lawmakers? That's kind of something we try to do, but you all may have some important insights on that as well. So on the first question is where did the money come from to do the investments in RX Kids?
Yeah, this is such an exciting answer to give. So it was a mix of philanthropic. We have tons of philanthropies that have come alongside the program, started by the incredible C.S. Mott Foundation. And also a very big chunk of it comes from TANF, Temporary Assistance for Needy Families, the block grant that we thought in 1996 was a workforce time-limited welfare program. But actually, it turned out it was such a flexible funding stream that most states have figured out how to sort of stop giving much cash assistance at all, and our caseloads have dropped dramatically, and use the money for other stuff. Unfortunately, a lot of times stuff they were already spending on. And so policymakers from Paul Ryan to Barack Obama have said, we need to right the ship on this. This is not what anyone intended with the 96 welfare law to just give states a blank check. And so RX Kids, working with the Biden administration, figured out a pathway to use an arcane provision called non-recurrent short-term benefits that allows you to provide a short amount of cash money to people in an economic crisis. So what was the economic crisis? It was childbirth. It turns out that is the biggest economic storm that families see throughout the life course. And so the first 4 months, that $1,500 prenatal payment, and then the first 3 months is provided by TANF. Then philanthropy comes on board. But since then, actually just in the last few weeks, there's been so much bipartisan support for this program. We have maybe more Republicans who have spoken in favor of it than Democrats. I think that's because reporters are more interested in that bipartisanship, because it has champions across the aisle. It saw another big increase. We had $20 million in TANF for the program to spend on these 11 communities. And the state of Michigan legislature has now committed $250 million on top of that to expand even further. So we're going to go from about 3,000 very cute babies and 3,000, 1,500 expectant or 3,000 expectant mamas to about 25,000 in the next couple of years. So a very concrete thing, I think, is talking to policymakers. If this is a program that you have interest in, Dr. Mona, who's my co-founder on this, will be going to Mississippi, for example, at the invitation of the state legislature, the majority party in the state legislature, to testify in the program as a way to combat infant and maternal mortality. So she's going to be down there next week. It's something that has just crossover appeal in a way that surprises me, right? This is just something that in this time when it seems like nobody can agree on anything, that this is a program that actually has some appeal. And so we're excited to talk to different states, well into conversations in the state of Washington and the state of Oregon with policymakers about spreading this, in this time when we think maybe there's not a lot we can do at the federal level. Maybe this is something that a very broad coalition of states can do.
Chantel, any thoughts on what can we do? How do we spread the great research that both of you have done and the work you're doing, and get
Yeah.
people to really understand these points that you all are raising.
Well, I think Luke set out a great roadmap there, right? Like local initiatives still matter. Local policy still matters, and state level policy still matters. And so all of it matters, honestly. But I think we're rightfully consumed with everything going on at the federal level, but there are so many policy levers to be had at the local level to really try to get kids prioritized there, right? And across all levels. So we're really in the business of, providing the data and providing the research and, thinking through clear policy recommendations for those things, and then, handing it to folks to really use that and share it as you do, Bruce, and as other folks in your space do. So.
No, I appreciate it. If you all, you don't mind, I'll need to get to Matito before we run out of time, but I really, really appreciate both of you and all you do, and definitely want to have you back many times as a friend of First Focus to keep getting the great work that you're doing out into the public. We really feel like, if the public just knew what was going on, they would be supportive, and the stuff that both of you do is just so profoundly important. So thank you so much for what you do and for being champions.
Thanks for having us.
Great to be with you.
Thank you. So last, but not least, is our friend Matito Watson, and just a few words about him is he's a senior fellow at Georgetown University Collaborative on Global Children's Issues. He previously worked on the Children in Adversity team at USAID, where he managed projects that provided technical support for primarily children and families in Africa. He brings over 30 years of experience working with children, education, public health, and child protection. So he's going to tell us a little bit about the crisis that's going on with respect to international assistance. But I won't ask him what's going to happen because I don't think any of us know. But anyway, turn it over to you. Thank you so much for joining us.
Thanks a lot, Bruce. And yeah, it is. I'm not sure why you wanted to end on international development today and the effects of the foreign budget cuts on children globally and their families, because it is probably, as Chris said earlier, one of the darker parts of the impacts of these foreign cuts. I think domestically, we are seeing a lot of red flags, and I'm complete alignment with what Luke and Chantal were saying earlier about these effects. It always baffles me we have the evidence and we know that this investment in children is good. Like, it is good for countries, it's good for communities. If you look at the work of James, I'm totally going off script here for a moment, but the previous speakers really kind of inspired me. If you look at the work of the economist James Heckman and really looked at that investment in children, every dollar that you invest in children, you're going to get anywhere between, very conservatively, $4 back all the way up to like $15 or $16. It's a smart investment. And it's very unfortunate that children don't vote. It's very unfortunate that children don't have jobs. It's fortunate as well that children don't have jobs because they're not seen as some of the political players. And unless you have that voice and representation for the rights, they get kind of left out, even though it is such a smart investment. And I was sitting here listening to Representative Castro. It was a year ago today that Representative Castro spoke at the launch of the whole of government strategy for children and investment. And that is not just USAID, it is State Department, it was HHS, it was Department of Labor, Justice, Education. And this was, really strongly connected with the Thrive Act. So I'm completely supportive in, if we are able to get a special advisor back, that we have at least someone in our government that is speaking on behalf of vulnerable children. Legally, we are still under Public Law 10995, which requires that we have a whole of government strategy to really address these issues. Um, Clearly, that is not a huge priority right now. And not to take a negative turn, but you know, for 8 years, I was working as part of the Children University team at USAID, and I I proudly wore the fact that the U.S. government invested more in children's development, care, and protection than any other government around the world. I mean, the USAID funded program really had a kind of a whole child approach in terms of what we were looking at with education, with health, nutrition, livelihoods for vulnerable households, and that has all been pretty much erased with the cuts to USAID from the Executive Order 14169 last year. And then not to really kind of overhash what happened from January, February, March, really thinking about what's going to be going on with USAID. We all know USAID has been dissolved. About 83 to 85% of our programs have been eliminated, seen as unnecessary, not aligned with the priorities of the domestic U.S. government strategy. And about that, around, I guess, 16% of those have been absorbed into the State Department, but really a very narrow focus and a really unfortunate definition of what is life-saving for children around the world. And I think, you know, we are talking on a couple of different levels. Like we just hit the tip of the iceberg in terms of really understanding the impacts of what these cuts are going to have, not just in terms of life and death for vulnerable children, but in terms of like global impact. I mean, we do not live in a bubble. We are all kind of connected. And as these impacts are hitting some of the more vulnerable countries, that's going to have global effects, including the United States. I mean, we're still doing trade with a lot of these different countries, and if they're not providing a strong workforce, and if they're dealing with a lot of other issues, that's going to affect us as well. But, you know, just alone looking at the cuts to PEPFAR, it's projected we're going to have around 6.6 million orphans that are going to be impacted, and we're likely going to see an increase in HIV positivity going forward because they were doing such great work. I mean, we're talking about basically backsliding on 3 to 4 decades of investment, building kind of on top of each other. And not only are we looking at incredible brain drain on the ground with experts that U.S. government funding had done both through academia, civil society, supporting host government projects, but an entire sector of NGO workers, experts, researchers are no longer kind of currently being funded. So we're not generating that evidence. We're not monitoring what's going on kind of out there. And we at Georgetown, much of the Children University team has been able to work over at Georgetown to try to capture these impacts. But right now, it's just way too early to see. We just know it's going to be bad. The question is, how bad is it going to be? And there's been lots of modeling out there. UNICEF and The Lancet and others have projected. In fact, Representative Castro stole one of my the 4.5 million under 5. The Lancet predicted could pass away from these cuts. Looking around 15 million children really being disrupted with nutrition services and life-saving services. And an apparent attack on education, which is critical for the development of children moving forward, both domestically and internationally. We're seeing huge cuts. And that's just the kids that are in households with caregivers and have some sort of security. When you're really looking across the board of those most vulnerable children, children that are being trafficked, children with disabilities, LGBTQI plus children, children in child labor situations, street kids, those kids are really going to have a tough time. And we're going to see a huge increase in violence against children, against those children, because of the protective factors that were previously existing for them are now been basically eliminated. And so these cuts, when they happen, they really kind of ripple the fabric of society. One of the strategies that we really focused on at USAID is working directly with governments around that system strengthening. And that has been one of the upticks in terms of, while unprepared and certainly not the level to really address the issues without the US government funding, we are seeing some governments using that input for the past couple of decades to be able to step up a little bit to protect and address some of those kids. But long story short, these cuts, the woes that we have in our society are often traced back to things that adverse childhood experiences that children experience. So by not having the ability to really ramp up the good things that children need to develop, and by not being able to ramp down and prevent the bad things that children experience, we're much more likely to see increased amounts of public budgets globally going towards things like security, going towards things like incarceration, going for things like, rather than community improvements, they are investing in social protection mechanisms because individuals can't really be able to provide for themselves. And I think we've learned an important lesson here in that, we've had a lot of dependence on kind of the US government and the government. And of course, like what has happened in the US has caused a ripple effect around the world. So we've seen decreases of investment from EU. We've seen decreases of investment from FCDO. We've seen decreases of investment in other kind of major donors. And some of those like global systems that we're dependent on, like UNICEF and the United Nations systems, also are taking a huge cut. So like we're just seeing ripping of holes, and just that safety net has few places you can land safely anymore within it. And I think this is a real cry, and one of the things that we're looking at Georgetown is really, how do we look at models that really look at sustained investment, not really dependent on kind of singular one-off or 5-year programs, but long-term sustained investment. And one of the things that USAID we're really proud of is really trying to work towards that sustainability. I mean, it's not easy given history and culture and all the other things that are happening, but we were seeing some really good progress with the investment of evidence and the experiences that we had on ground. And I think, we have always been fans and allies with you guys, and we've always loved the budget book because it was a great way for us to work hand in hand, things that we weren't able to do at USAID, you guys could do. So I think this is the time. A couple things is that, we really need to come together and push for that budget. Like, it is just such a small sliver. And I don't know who said it earlier, but if the American public had any idea about how little of an investment we got for the bang for our buck globally, and if the American public had a better idea of how much what happens outside of the United States will affect eventually the United States in terms of global security, in terms of global trade, in terms of stopping disease, they would be more alarmed about the cuts that we're having. I think this administration in general, and a lot of people really underestimate that power of the soft diplomacy and the investment and what that brings to the reputation of the United States, and completely underestimates the appreciation that most of the world has for how the United States previously was really helping to move that forward. And as we're seeing more and more of this, I imagine it will start a little bit more with the public outcry in terms of really seeing some of the famine, some of the devastation that will happen. And as that kind of builds up more, hopefully we'll have some ways to kind of move forward a little bit better. But with the proliferation of digital and the proliferation of AI, I think there are other monsters under the bridge that we have to keep our eye on, as we don't have a complete view with our networks and our partnerships as we had previously with USAID, as those can cross greater threats. So unfortunately, I'm ending on a very much of a kind of a grim note. I think on a positive note, the community rallying globally on children's development, care, and protection is banding together. We're trying to put our heads together to figure out what we can do next. How far can we stretch what little money is left within the sector? How can we spark innovation? And how can we best kind of circle our wagons and weather the storm?
Thank you so much. And I will say, like, loved everything you had to say. And I think one of the things that, both you, Luke, and Chantel, and of course Chris have really noted is, I mean, Chris is probably sick of me asking this question because anytime I start writing a blog, I try to reference the share of spending in the budget, and I keep having to ask him, is like, wait, is it, like when you talk about pennies on the dollar, it's like, no, it's less than pennies on the dollar. We're talking, and it's not even a fraction of pennies on the dollar. It's, as Chris showed, the president's budget is 0.03%. And so I keep having to ask him. In fact, one blog I had to go in and change because I think I put 0.3, and no, it's 0.03. So it really is unbelievable for just little money we make such a difference, and how devastating these cuts are. So you did leave us on moving toward a higher note, and so I want to add, give you a further opportunity on that is, and some of the questions in the chat have been about this, is what are some of our opportunities as a community to basically, if we care about, and we firmly believe that the public agrees with us, and polling has shown that they want to end suffering and preventable deaths of young children, and for children to reach their full potential. What are things that we can do together as a community to kind of right the ship on this? And I really think your point on sustainable investment is critical, because I think people have this weird thought about, well, we made an investment, and why haven't we gotten rid of child poverty? And of course, it's like every year it's a new generation, it's a new set of kids, right? And so people have this weird sense of why can't we just make this one-time investment, as you pointed, and so why does it need to be sustainable? So I sort of giving you two questions in one, but
Well, not easy questions, either one of them. So let me do my best. It's the same question all the time. Like, why haven't we got rid of homelessness in America? Like, why haven't we got rid? There is money to invest if that's the priority, and there are evidence to be able to address that if that's the priority. It's not the priority, and if you're thinking around the way that we're slicing the pie, and what is waste, fraud, and abuse, and we look at the different budgets as they were January 18th or 19th and how they are now in this new administration, I think a lot of people would be somewhat outraged if they saw how much was being spent on new buckets that have been put out there. And I think part of that is our responsibility to advocate. So I think it's really part of us to really reframe the narrative, to take analysis of where we are now and how do we put children first. And I think we are in positions of power, more or less, to be able to get ears and advocate and bring people together and be able to really have messaging. We've got the data, we've got the evidence. I think so much of it is in terms of what's it's just also not what's right or wrong, but what's politically acceptable at the moment. So I think how we frame our message, we have the ability to really change hearts and minds, and that hopefully can change dollars and investments. It's not all just about dollars and investments. We put a lot of money into a lot of things, Afghanistan, for example, and may not gotten out as much as we want. So I think the how we do it, I think really thinking around that system strengthening, really being able to work. And change is slow, right? So people you're not going to do it in a 4-year period. You're certainly not going to do it in a 5-year proposal. So that sustained investment over time, working alongside governments, bringing that technical expertise in. I think protect what remains. So there is going to be some work still within State Department around this. So how do we influence what dollars do come out of State Department? I am hopeful that we can still have positive dialogue with the State Department around these things. People don't want kids to get hurt, so that's a good thing. But they got to put their money where their mouth is. I think we have an opportunity to look for a lot more of lifting up of kind of South-South advocacy. I think there's a lot of good networks out there, global networks, regional networks, local networks that could benefit from our evidence, from our experience, to also put some pressure on not US government funding and really think around how do we go with a little bit more of a blended model that would allow, when you have a big shock like having your budget removed with the US government, they can survive a little bit more. And I think things like this, I think we have to leverage moments of visibility and make it seem not quite so hopeless, but I think us working, kind of together as a sector or a group help to find a couple goals that we can commonly agree on. And now is the time not to compete for those little dollars, but stretch those dollars together to move forward. And if we can get somebody in, a good person in, as I worked under kind of 3 special advisors, get a good special advisor in there to help drive some of that. That is a critical, I think, a critical element of that voice within the machine. We've lost so many of our strong advocates within the administration.
Yeah, I agree. Well, so thank you so much for joining us today. We really, your presentation was awesome, and it's great to have you as a partner and colleague in the space. And so thank you all for all you all do at Georgetown. And so I just want to thank everybody today who joined us. Thank you for giving up a part of your afternoon to join us in this very important discussion. I want to first and foremost thank Congressman Castro for his being here today and his just consistent leadership on children's issues, both again domestic and abroad. And thanks to Chris and the team at First Focus for releasing the report. And again, if you would like a copy of it, and it is live on our website at firstfocus.org. And again, contact us. We're happy to send you a hard copy of it. And I also just want to thank our outstanding panelists, Chantel Meek, Luke Schaefer, and Matita Watson, for all the great work they do and for just being terrific partners in this space. For their intellectual leadership and partnership is just tremendous. And so thanks to them as well. And again, thanks to our philanthropic partners for making this all possible. So we really appreciate it. And we will have, if you want to share it with other people, this discussion, we will have, I was hope in the next day, something up on YouTube that people can share to hear the discussion, and also please share our website and the report with people. We think it's very important, and to sort of underscore what Chris said, it's a terrible story, and it's going to be worse unless we change direction. And we've got to get across to people that this is unacceptable. We need to be making investments in kids and not disproportionately targeting them for harm. So thank you all so much. Have a good afternoon.